I'm a music scholar, and it's nice being with you. I like using music as a therapy, and I think it's imperative in the science to always have therapy because we combat very many things. Thank you very much. This is the first time I'm singing this song. I just released it last year, end of last year. It's called Sekanyolia, about a long bird, a bird with a long neck in Uganda. Agenda nakuwana wana nawe nobegerera nakuwa kano nakali nga tasibye namu buli kizibu ky'omugamba akola ne yeemalayo n'omatira nti teri kabi ekiva ewuwe ndaba kulimba nakutuga ngamba gwe kibuggulu weefudde kiggala amaaso ogakutte mu ngalo lwaki tolaba wala nga Sekanyoli oyo bwe walampa amaka g'oyonoona watyanga gamaamawo oyakulimba weekala n'abaana be ekyakuleka ne wokaaba amaziga nga bakutaddemu teryakutunulamu n'abaana bakukyawa wadoobya maama waabwe oyakulimba weekana n'abaana be ekyakuleka ne bwokaaba amaziga tabakuzaddemu teryakutunulamu n'abaana bakukyawa wadoobya maama waabwe bannange njagala mube nga Sekanyoli oyo agenda mpola n'alaba n'afuna ekyokulya temufuuka biwuggulu amaaso n'obwongo mubikozesenga balabula ebirungi bya bugumiikiriza balabula ebirungi bya bugumiikiriza nze mbalabula bya bugumiikiriza balabula ebirungi bya bugumiikiriza tekigaana kuzinamu the rumba style. Hey. Eva. Thank you. Thank you so much. That was Sekanyolia, talking about the girl child, trying to advise the girls to avoid dating sugar daddies. Thank you.
And sugar daddies are basically cross-generational relationships. A 15-year-old girl getting a 50-year-old, someone old enough to be your father or grandfather. These things happen in our communities, okay? The social workers can bear witness to that. At this point in time, we are going to have a silver sponsor. We have very many sponsors and people that have donated towards this wonderful, amazing conference that so far so good since I came to Canada. I think it's my number one extremely beneficial and greatly organized. A big hand clap, I thought, would come after that. For the vision bearers, thank you. You have really done so much good, bringing a job fair on the outside and then a brilliantly, fully packed, knowledgeable, wonderful speakers in here. We have people that have gone an extra mile in making sure that this comes to this level. I have met their stall, and trust me, it's amazing. So I want to thank you, Shintha Alam, for leading a delegation of Dixon Hall here. These are people that get us jobs in Toronto and in Canada, world over. We already have her brief here, so you can be able to go and revisit, but let us get her address because she's one of, actually, the silver sponsor for this amazing conference. Thank you so much. One clap for her. One, just one. Cha. Let's do 1, 2, 3. 1, 2, 3. Brilliant. Thank you.
Yeah. Hello. Do you mind if I? Okay, it's just better for me. Sorry, I was struggling with the mic. Hi, thank you for having us here. The food was really great. I didn't go back 4 seconds, but it was really good. It was nice to have some like flavored chicken at an event, so that was really good. Thank you so much for having Dixon Hall here as a silver sponsor. We do have a booth outside, like she mentioned. We are helping with resumes and cover letters, so if anybody needs any help, definitely walk down to our booth, and we're going to be here all day. So first I wanted to start by doing a little bit of a land acknowledgement. We would like to acknowledge that the land that Dixon Hall operates on is situated upon traditional territories of Huron-Wendat, Anishinaabeg Nation, the Haudenosaunee Confederacy, and now the Mississaugas of the New Credit First Nation. Today, the meeting place of Toronto is still the home to many Indigenous people from across Turtle Island, and we are grateful to have the opportunity to work in the community on this territory. So a little bit of a background of who we are as Dixon Hall. Dixon Hall started as a soup kitchen back in 1929, and eventually it progressed onto different departments, and now it's a multi-service organization. I'm here from the Dixon Hall Employment and Settlement Services. And just kind of to tie up everything that we've already heard from these beautiful presentations that happened in the morning, how is employment related to social and health? Like, how does those things tie in together? Well, employment is a key social determinant of health. As Dr. Curia already mentioned that there was the healthy immigrant effect. There is a healthy immigrant effect that happens. So one of those things that happens is that a lot of newcomers come into Canada, for example, they come in very healthy, and Dr. Curia beautifully explained how that happened, and their health often deteriorates. And one of the leading causes for that is definitely employment, because once you have sustainable employment, with employment you can get health benefits, health insurance, you have affordability for housing, and you have affordability to go to like specialized appointments, but without that economic stability, you're not able to get those resources. So to make things more accessible, we want to help newcomers and those having those access to like barriers to employment. We want to help them and motivate them. We work with them one-on-one. We have employment counselors that work with the individual one-on-one to give them help with figuring out a career plan, how to transition the role that you maybe had back home, and how can you take your transferable skills and how can you use that for skills that you can get a job in Canada. We help you figure out what are the bridging programs that you can be taking in order to get certified here. So that's a little bit snippet of what we do under employment services. Again, we have people working with individuals one-on-one. Our participation satisfaction is 90%. So as we all know, like I'm sure we've all somehow, or if not, our parents have immigrated to Canada, and the job market is not the same as it used to be. Before we would see different trends. We would see people that are coming to us, they're struggling with jobs and they don't have a lot of experience. However, now we see a lot of people struggling to find employment. They have a lot of experience, but the market is so saturated that it's becoming really, really hard to find that employment. So, and that could be very challenging, especially if you're a newcomer. You're already struggling with so many different layers and layers of barriers and problems, and navigating that on your own can be very, very difficult. So our employment advisors, job developers, our entire team is there to kind of hold your hand throughout it. It could be either we can go speak to employers directly for you, or maybe you don't need that. You just need that editing of your resume. You need to figure out how to make a cover letter better. A lot of the places, like I know from my country back home, they don't have a resume. They have a CV or the way a resume works back in my country is very different than how it is here. So maybe a professional that's really well trained comes in with a CV from back home and they think they're doing a great job, but they're not even being considered for the job because of the format of the resume. So it's such a minor thing, but it does make a big difference. So our team is there to help with that. We also work with employers one-on-one. So employers might be looking for something specific, and we have so many clients that we can match employers with the right clients. We have volunteer mentorship programs where we have mentors that they had the same situation as a lot of our clients, but they're able to work with our clients one-on-one and on a voluntary basis to empower them, to get them past that fear and the whole question of what's going to happen to me next. So we're there, our volunteer is there for that mentorship and guidelines. We also have settlement services. So I manage 2 different departments, employment and settlement. So with the settlement services, we help newcomers so integrate into Canada. So anywhere between filling out forms to accessing healthcare, we can help you refer to the right person. We can help you fill out those forms. We have settlements workers that speak different languages: Bengali, Hindi, Urdu, Saraki, Persian, so different languages. And if we don't, we also have volunteers that can help translate. So these are just a snippet of the things that we do in Dixon Hall. There's obviously our housing department is huge, and we have shelters as well. And our children and youth department, we have services for families that are of low income that can join music schools for a very subsidized rate. So when I say multi-service, I really do mean we're doing a lot. And because we're housed close by, and our departments, we can do internal sharing. So you come to our door for employment, we can refer you to other things. So it's somewhere you can come in, and we are there with you the whole time to help you with a variety of things. So if you're interested, definitely visit our booth and we can talk more specifics. And honestly, I'm really happy to be here. As someone with a healthcare background, I literally did my undergrad, my postgrad, all in healthcare, but I ended up in social work because it's so integrated, like mentioned before by Dr. Kiria and everybody else that just talked before me. So it is very important that we all work together and stay integrated, because social aspect and the health aspect is so combined. And in order to have a better mental health, to have better just social connections, it's so important that you're connected to the right organization. So definitely reach out to me if you have any questions. Thank you.
We appreciate you, Dixon Hall, especially when it comes to employment for newcomers. as well as settlement. Those are basic things that are extremely important. We definitely are going to have a question session a little bit later, unless there's an immediate burning emergency question. Is it there? I saw a hand up. But it's very important. Definitely. Can you keep it for a while? I definitely will choose you first when that time comes. Thank you very much. We want to thank you for knowing exactly where to put your funds. These are some of the places where you need to put your funds because you add a lot of value to communities. And all the people that may come in as immigrants and as asylum seekers, they add a lot of value later on when they settle in. They add lots of value in Canada. They may seemingly come in as they need Canada, but at the end of the day, now Canada needs them in return. So that makes a lot of sense, doesn't it? Okay, we are expecting the emerging role of social work in primary health care. The Canadian perspective from Abel. Is Abel here? Oh, he is still for lunch. Yeah, that lunch was really good. So some of us are stuck in there still having lunch. Yeah, no harm. We can have him later. At this point in time, we are going to have 10 to 15 minutes, another presentation. Integrated healthcare in the African perspective. How many of us here are Africans? African origin. You were born there, you grew up there, you groomed there, you migrated there. I think all of us, there was a time when you go for your DNA and I saw some white friends of mine telling me they have 3% of Africanism in them. And I also have like 15% of whiteism in me. So those things happen as long as you're a human being. It just, you will never know when when it will actually connect. We have Mrs. Salome Namvule, the founder of Pitmoff. Mama Pitmoff, where are you? Mama Pitmoff, stand up for recognition. Come on. Mama Pitmoff, thank you. Stand up for recognition. Thank you very much for being here. We really love you and the work that you do for the teenagers especially. Much of the social and health work is usually within teenagers, so we want to thank you. Mr. Tony Muzira and Mviri Ali, Center for Black Development Options Canada. Where are you? Right there. Thank you so much. And by the way, when you look here, all these are partners. This is not just for decoration. You see what caught my eye is there are so many conferences that go around and so many bivrus, we call it bivrus sometimes. And this particular poster caught my eye and I had to reach to the vision bearer and I told him that, you know what? I need you, you need me, we need each other, we are stuck together and I'm going to be on this team. Because of this, there's some seriousness you see in something organized and you're like, how can I miss out on this? So we want to thank Access Employment. We want to thank Global Events Canada. We want to thank Media Inc. We want to thank Great Lakes Peaks, Dixon Hall already. Of course, the government of Canada, Skin Novet, Hope for Hearing, Imagy Green. There are so many lots of here. Make sure that you get a business card from each of these people here. Are we together? Because you're not here just to listen, but also to take away something to be able to follow after. This is what we call following after, yeah? That resume needs to be taken, that job needs to be got. Yes, lots of opportunities. Canada is a land of opportunities, so we don't only want to stand on the land, but we also want to grab the opportunities. Hallelujah. So Dr. Ricardo, are you here, my dear? Yes, at this point in time, Dr. Ricardo John Munyengera is coming in. Of course, we already have something quite lengthy about him. Yeah, Africans are very good at describing what we are and what we do. Yeah, that's the energy. That's the energy, the African energy. You get me, yeah? Sorry about that. So we shall be able to read. Even back home, you can be able to read this particular profile. Let's go straight away into the presentation. Thank you very much.
Sure.
Mr. Ricardo John.
All It's okay? Okay, thank you. Okay. Hello. Okay. I just, when I was sitting there, I was trying to learn everything. This conference, I think, is getting me into the understanding more about we as Africans, but at the same time, how we take on health in the different perspectives. Not only where you come from, either from Uganda or even from the rest of the global south. Oh, okay. I'm looking at that topic which is concerning integrated healthcare in the African perspective. Just as like our MC has talked about the aspect that most of us here has that element of African or being African, or at least maybe 30% or 1% African. I was trying to understand this integrated care because of what I went through myself. Just a short story. I had an accident in 2022, and right now I have an implant in my spinal cord because it was a burst fracture of thoracic bone and lumbar bone 1. So this is how I got to understand more about integrated healthcare in Africa. So I think without discussing a lot, I'm just going to look at some of the key concepts. What is happening in Africa? And at the same time, how do we take integrated healthcare in that narrative, as well as looking at the recommendations and the rest other issues in the conclusion. I'm continuing with this research and writing a paper in relation to this systematic review of what is happening there in integrated healthcare. So some of the key concepts I encountered was the aspect of integration, healthcare, and integrated healthcare in itself. It has been defined by many scholars, but I want to talk about what Chelsea in the African context defined integrated healthcare. They looked at it as an approach characterized by a high degree of collaboration and communication amongst health professionals. So here, this is something which they looked at in the context of looking at medical professionals as well as clinical social workers and those who provide the services as the professionals. So in most of the African countries, it varies and the perception gets the narrative different from, for example, West Africa and also either East Africa or the rest of Africa. There is that narrative whereby you understand something in relation to how you perceive it. So that is how they looked at it. And then they gave a very good analysis of why it is so much important for Africans to take on that. So looking at the introduction of integrated healthcare, I found out some of the features as to which this has, but at the same time also the differing approaches. One of the issues which came up in the systemic review I did on the different papers was the aspect of the knowledge gap, whereby what is being discussed within West Africa is is very far from that in Eastern Africa. So it's the same in Southern Africa. So there's also the cultural context, which has also come in at a different perspective and bringing in many different issues. For example, when you look at social work and social care, especially within Eastern Africa in relation to Southern Africa, there's that element of Ubuntu, whereby you keep into interaction with the rest others in relation that I support you, you support me, and you are your brother's keeper in the context of even giving health. So that was one of the notions. And then, of course, others look at it in the context of being rehabilitative. This was found out, especially within South Africa, Malawi, and even Kenya, that it is something which is given and much more important. And then also the development of cells, or even besides the hospitals, there were also the development of integration centers, whereby people go and discuss about the different chronic diseases or the non-communicable diseases, and how social workers need to intervene. And then, of course, when you look at it in the context of also education, they were also looking at it in the context of how they must separate social work as a profession to social work and social administration. In most African countries, or especially Uganda, if I can give that example, social work was amalgamated to the social administration. But currently, the universities have also come up with the aspect of differentiating the two, that social work is independent of social administration, and now it's now a professional course. So when you look at it in that context, it has also brought about professionals who are working on integrated healthcare and supporting the clients, or maybe the patients. When you look at the different models, there are many models which have been introduced in Africa, or even emanated out of the cultural context in the different countries. Some of them are, like, for example, the inclusive or parallel model, and then the decentralized model, integrated, chronic, or either community-based. And these are some of them, even though many of them are differing. For example, when you look at the integrated community-based model, this is mainly in East Africa and Southern Africa. When you look at the inclusive model of healthcare and then integrated chronic, that one is much more into West Africa and Central, as well as the interdisciplinary and holistic model is something which is very unique to either Kenya, Uganda, and Malawi. So that is how they are looking at it. These different models are trying to make sure that integrated healthcare is something which is needed in the African context. So if I can give also in West Africa, for the consultative model is one other model which is being employed, especially the use of modern medicine and the traditional medicine into supporting patients, especially on the aspect of mental. And then there is also an interesting research which is going on in between Nigeria and Uganda in relation to how this consultative model is employed. So I wanted to look also at the components, the differing components in the integrated healthcare. These components are quite many, but to capture a few is like the chronic conditions, and then the patient involvement, and then the coordination and organization of care. So this has been exemplary, especially in addressing the issues to do with the chronic diseases as well as the non-communicable diseases. This one is one example where you can look at the aspect of how HIV/AIDS was handled previously in the 1990s and even to present day. That the chronic model was adopted, and that it was successful in many countries, especially Uganda and Kenya, Malawi, and then Zambia later on. Then it was followed by also South Africa, whereby it was modified into the integrated approaches to care. So that some other issues were brought in, for example, membership of the different people, different patients, and even patients having access to the social workers, but at the same time as their medical their medical professionals, and facilitating that understanding of the disease and how to handle it. That was something which was brought in that context, but at the same time has helped to alleviate some of the non-communicable diseases, but also the fight against HIV/AIDS. So when you look at the different cases, they showcase a different analysis, looking at the community-based model in relation to HIV/AIDS and non-communicable diseases, and where screening happens, but at the same time, what needs to be next, which is either the case model number 2 or number 3, and then finally, case model number 5, which cuts across each and everything. So when you look at these features, you can generalize them by looking at the different countries, as I made the review. For example, all of them are patient-centered, and then the accessibility is what is much more crucial, especially for both patients and the healthcare providers. And then the aspect of effective use of resources. Of course, the meager resources which are there, because the funding of health in Africa is something which is still wanting. And then, of course, the comprehensive, and finally, the holistic approach. So some of these are prominent in one country, and it varies to another. And then these approaches can be categorized. Some of the few categories I just brought out was the extending of primary care, clinical pathways, a community-based approach, then collaborative, the palliative, and then diagnostic, as well as the final one, which helped me out most of the time, this which I call the integrated holistic approach, whereby patients with this holistic approach option is centered mainly with the health needs of the people, or maybe the patients, and then the communities, thereby enhancing community self-reliance. In this context, I mean, besides the surgeries I was going through, the social workers, the clinical social workers were there on time, but at the same time also discussing with me how I can go through the whole process. Because I was reduced, I was just in the wheelchair, unable to move, but there was need for that, the different sessions which were coming from the clinical social workers, but at also the same time, undergoing therapy, both physical and then even the psychiatric one. So when I look at it in general, I realize that integrated healthcare is much more something very useful and important in Africa, in case if handled very right. Looking at this, I cannot go without looking at the aspect of the challenges in the integrated healthcare. These are quite many, but I just tried to point out a few. For example, limited resources and infrastructure. This is something which is like in most of the African countries, in exception of, I think, South Africa. But the rest of the other African countries, they lag behind in terms of funding healthcare. Therefore, integrated healthcare in Africa is also a challenge. Then, of course, the cultural and the linguistic barriers. This is an obvious case, and in most cases, this has happened, especially in the central part of the continent and also East Africa. And in political instability, this is central, and the rest in the many countries. And then, of course, shortage of skilled healthcare professionals. Now, this one has two contexts. The skilled manpower, or maybe the healthcare professionals, most of them have left the continent. After training, they leave the continent. So they bring in, yes, there is training, but at the same time, there is that very big gap. So people tend to go for greener pastures, and this is a challenge to the different ministries of health in Africa. And then the high burden of the infectious diseases, or that is in case from it goes case by case from one country to another. So I looked at even the example of Uganda in the context of the poor medicine supply for non-communicable diseases has probably been the major setback to the effective control of the non-communicable diseases. I looked at this in the context of the analysis which was done by Moyo when they were trying to understand what challenges health workers facing in Africa, particularly East Africa. So after looking at the challenges, there are also some opportunities which are being harnessed out of healthcare. We are looking at its focus in terms of prevention at early intervention, then integration of traditional and complementary medicine practices. This has been, much of the research has been done in Nigeria, Ghana, Uganda, and then Tanzania. So when you look at the potential for collaborative and interdisciplinary approaches, as usual, the medical professionals are hesitant in some regions of Africa to associate their research or modern medicine to that of the traditional medicine. This has been observed almost in every country. Yes, they say that, how can I term this? Issues of mental health, for example, how they are handled in between the modern medicine versus traditional medicine, it has a very big problem to convince people, especially health professionals, that Mama Fina or maybe the medicine men can do something. So that is one very big. That's one very big difference in terms of integrated healthcare is implementing. But of course, there is also growing recognition of the importance of integrated healthcare. Many countries are taking it on, and then also there has been kind of like investment into integrated healthcare. I can give the example of Uganda. What is going on right at the moment is, for example, to the HIV/AIDS patients or those who have tested positive to HIV, where they are getting their medicine. So they have decentralized the system in that those who have been on that on the ARVs for some time, either 6 months and above, can pick their medicine through the different clinics within the area where they live. This has not been the case previously. So because of how it has been handled, when you look at how everyone has looked at it in terms of the policy, but at the same time of how the funders of this project are doing, they have helped at least the patients to get their medicine on time, which has been a problem previously. So, of course, some of the suggested solutions were many, but we can just look, just a snap through of a few. So, for example, develop and use African-centered health information systems. Information has been a very big challenge in most of the African countries. So, in case if that is solved, then it will create a very big impact. And then, of course, promoting community-based and patient-centered care. Just like I mentioned that having gone through the same system, the patient-centered care really helps, and this is what integrated healthcare talks about. Then, of course, not forgetting the interdisciplinary problem solving, right from not only health professionals, but social workers, as well as community leaders. And then, of course, not forgetting the policy itself. Then, as we continue with the recommendations, there's, of course, decentralization and the devolution of health services, which I have mentioned. For example, if I can mention many countries in Africa, Malawi, Kenya, and of course, obviously Uganda. I don't know why I'm repeating Uganda, but there is those people we call village health or VHTs, trainees. These have been much more helpful, especially in the rural community, in the rural part of Uganda, or even in Kenya. So, in terms of not only registering patients, but also advising them, working hand in hand with community social workers, those who have been now trained through the different universities. Some of the leading universities in Uganda, especially the private one, which started this, was the University of Mukono. Is it UCU Mukono? Uganda Christian University, sorry, Mukono. And then, of course, Chambogo University. They brought out two aspects of, for example, the community social workers who are attached to the different, not only to the hospitals, but attached to the communities, so that at least they can identify, register, and advise patients to at least follow up on their medicine, and also give them the chance to get healthy. On the other aspect, of course, there is digitization of health. Right at the moment, as the digital space is increasing, it is not only affecting these other spheres of life, but also even into health, whereby a lot of not only advancement, but also the aspect of talking about how social workers, how health professionals are handling different discussions, forums, and then of course conferences like this one, so that at least knowledge is distributed, and at the same time someone can learn a thing or two. And then of course community engagement and participation. So community engagement in the context that right now it is not exactly that in education, if I can use that example, that clinical social workers are not only attached to the hospitals, but also even to the community. So the holistic approach and the learning processes which they go through have helped to change the system, and at the same time the perspective of healthcare in general in Africa. I think my time is up. Thank you so much.
When we start talking about knowledge and people's well-being, it will take so many days and so many hours. We can never exhaust. And that's why annually this conference runs. So every time it's going to run, be the first one to sponsor, to register, to volunteer, or to register to be an attendee. Let's give him a wonderful hand clap. Thank you so much. There's so much to learn, and there's so much new knowledge that comes to best that we need to always revisit and refer to. At this point in time, we are going to have our questions and answer session. That is one of the sessions that I love so much, because from you, we have very many dignitaries that have something to say or something to ask about something that has probably been left out. So at this point in time, for those who presented earlier, please just come and sit on these softer, more comfortable chairs, please. And then we shall go through a quick question and answer. And while they come, I just was here and I thought about the word mentor. Many times in healthcare, we are so quick to see the blood, someone is bleeding, someone has a big wound, or someone got an accident and needs physical help, or physical medical help. And many times we forget the mentor. Mentor is like a cancer that eats us slowly but surely. You get that disappointment from a loved one, disappointment at work, disappointment with your children. It can be just about anything with the finances, and it worries you all the time. You even lose sleep and you don't even want to eat. So slowly but surely, if you do not take care of it with the therapy here and there, it eats you up. And before you know it, you can't be as creative and as well as you should be. And the moment the mental health has issues, definitely the entire health of a being becomes a problem. So the word mental, M, would be medical therapy. Quite quickly, run for it if you feel that that's what you need. Or mental therapy. You can have your own positive thinking. Divert yourself from the negative thinking of a situation eating you up and start thinking hopefully and positively about it. And sometimes, many times, we get the answers quite handy. E stands for emotional therapy, from loved ones, from family, from relatives. Okay? And then an N is nutritional therapy. Are you taking too much sugar and it increases your stress levels? Are you taking too much oily food? So try to go vegetarian, try to go fruity so that you get that nutritional therapy to take care of your mental. And then T is traditional beliefs. We have those stories that our grandmothers used to tell us that actually instigate a lot of positive thoughts that make us feel better, even if the problem still stands. So traditional therapy is very key, the beliefs that we have from our traditions and culture especially. A stands for art therapy, music, dance, and drama. We just saw her here dance and sing, and there's a way you put that smile on and feel much better. And the last but not least is L, standing for love therapy. If you can get someone to love you silly, please do, so that you feel better mentally. Yeah, beginning with God, okay? You have the love of God, but also love from a loved one, a real intimate loved one. These things sometimes work. Okay, I will go at the front and you give us the questions. I've been looking forward to standing up here. And I'm happy that, good evening, viewers. All right, I kindly request Clive to move with the microphone to, okay, she came first, and then we shall have Lydia. Lydia is one of the vision bearers of this amazing conference. Yes, my dear Black Beauty, what do you have to say?
Good afternoon, everybody. My name is Annabelle. I'm a Ugandan. That is good. I have a question. It's kind of burning me, and I would like to address it to, I want to address you as Miss Alam. I think I'm right. Back home, I was a technician, IT technician. So I came with a lot of expectation to come here and maybe do something in IT. But when I came here, things were so different because the rate of technology and advancement here doesn't no longer match with my mental health. So I was like, okay, what should I do or where should I be? So I decided to go social services. So I recruited myself to do mental health and addiction program. And the challenge is wherever you go. Hello?
Yeah, we can hear you.
Hello?
Yeah, we can hear you.
Yes, she's with you.
Oh, yeah. My challenge is now you've spent 2 years doing a diploma in mental health and addictions. Here you come with your resume and a cover letter. You post it everywhere, they're advertising. And if you are successful, they call you for an interview. The next thing is they want the Canadian experience. So I want you to help me understand which company is going to recruit me without the Canadian experience? Because, at Dixon Hall, do you have training and development opportunities that we new job seekers can have so that we can gain relevant experience, relevant Canadian experience? Because it really, it disappoints somehow. And when you are ready to work and they ask you for 3 or 2 years experience and you are from the college, but they still need the experience. So where am I going to gain the experience? Which company is going to recruit me without experience? That's
They-
my problem.
They are clapping. And on top of that,
Thank you.
when expatriates come from what we call the extremely development countries and they come, maybe they go to Africa or to Europe, they never ask them for work experience in that very country where they have gone. I'm just saying, it's not me, it's them that are saying. So we need to understand that. Thank you. But at least we have Dixon Hall here and the rest of the others to give us those answers.
Yeah, and that's such a fair point, and that's something that we recognize as a barrier for a lot of people. And honestly, it's not like right now the government has removed that Canadian experience aspect from a lot of jobs, unless it's like regulated professions. Most of them, they're not supposed to ask for Canadian experience, at least in the government that has been implemented. But it's about the mindset of the employers that need to change. So even though lawfully they're probably not supposed to do that anymore, they're so used to that culture of that being the standard that they're not changing those cultural practices. So we always encourage because obviously you can't go back to every employer and do an EDI training or something like that to kind of teach them that you should do that. So as Dixon Hall, what we do is we stand as an advocate for our clients. So we work with employers one-on-one, speak to the employers, and we kind of tell them that, look, this person has all this experience, and they would be a really good fit. Some places you do need Canadian experience in terms of education, but other things you may not need a Canadian experience. You just need, let's say, volunteer experience. So, for example, I have an example from a client that came from Uganda. She was a teacher back home. She worked in social services. And then when she came here, she lives in a shelter with her 2 children, and she's looking for employment. She was on Ontario Works, which is like government support. And obviously it wasn't enough to, help her with her living. But then she started volunteering. So she volunteered for 3 months at an organization, which was a health organization. After volunteering, she was able to make connections. Like first she volunteered at one program, and then she volunteered at another program. And that helped that employer kind of, take away that bias, exactly, the bias and that mental, like the little thing that you think that, oh, they're from another country, they probably can't do the job. But they were seeing that as a volunteer, she was bringing a lot to the table. And then the employer, because we provide incentives to employers as well, to hire our clients. So then we ended up providing an incentive to the employer where they had a position available, and we said, why don't you take this person on for 3 months and see if that, like, just do like an on the job training for the person. And then if they fit right with the role, then they can become a full-time worker for you, but that onus is on you to employ them. But so as a service provider, we are here to provide that, advocacy, the incentive, things like that, to kind of be that middle person for our clients. So I would suggest volunteering is a big thing. I know it's hard and it's just a slow process, but even me, I graduated with a degree in Canada. I went to school from grade 9 to everything. And then after I did a master's and everything. And when I graduated, I applied to 60 jobs. I heard back from 2. I have Canadian experience. I worked all of grade 10 all around. Like after undergrad, I worked for 2 years as well. It's hard. So even as Canadians, it's hard. So I can't even imagine coming to a new country, how difficult it is. But with me, what got me a job was my volunteer experience. I volunteered at an organization. Eventually, I became a director of an organization and on a volunteer basis. And then from that is when that opportunity and the gate opened up for me. So volunteering, networking with the right people, you're here already. You're already doing step 1. So today, speak to the person next to you, speak to someone that is in the field that you want to work, ask them specifically, like, that's a role I'm interested in. What do you need for me to get that role? We have people that are really interested in personal support workers. We're here today as an agency, but also as a way to kind of find out from those employers that, like, what do you need for our clients to become a personal support worker? Do they need to go to school? Do they need this? So ask those questions and network and Yeah, and hopefully, like, it's a long process, but you're already in the good direction, and like you're taking the steps that needs to happen to get a job. So don't let it discourage you.
That's wonderful. Thank you so much. And we all know that some people get jobs through Indeed. They're back in their countries, and through Indeed and LinkedIn, they actually get jobs. And when they come here, they are trained before they get into those jobs. So in the process, you realize that they appreciate you before you even come to Canada. So I think we are hopeful. Thank you. You've really addressed it so well. Yeah, let's not fear to volunteer, but this time around, be intentional when you're volunteering. Go to that particular area where your discipline falls. Don't scatter your professionalism or your talents here and there. You know, if you're a nutritionist, then go to a food bank and volunteer there, or a restaurant, or, I mean, it can be anything. If you're a health worker, go to those areas where your services are required. Because when they realize that you're very good and you've displayed expertism, they will create a desk for you, even if the office is not yet there. They will realize that they need you more than they thought. So the most important thing is, when you're volunteering, what are you displaying? Are you being that person that creates a gap in an organization that they would like to retain you? You have to be your best as you volunteer, because you're placing yourself and giving yourself an opportunity for people to appreciate you. We want to thank you so much. Do we have any more questions? Clive? Oh, yeah. Oh, yes. Yeah. 2 more. You have something to add?
I just wanted to add one thing or two. That is in the context of those ones who are in universities or maybe in colleges. Okay. Is it okay? Yeah. All right. So those in universities, especially applying from there are two things you must do. According to the advice I got from my own supervisor at McGill and even the rest of the others, is that when you are trying to do your research, do it in the context of Canada. Not maybe, for example, you are doing your research, but you need to go back to Uganda. So your experience in research is going to be in Uganda. So when they are recruiting here someone in relation to research in the same topic, they will first consider someone who did theirs here. Me, I'm one of the example whereby I was doing research on the refugees in Uganda, but I realized that I need also to do some work here by doing research on refugees in Montreal. So that was one area of covering experience or even getting the Canadian kind of like job opportunities. The number two, which my supervisor also encouraged, was the aspect of EU in terms of placements, especially those ones who are pursuing their masters. Instead of going for the traditional thesis program, you go for the one which calls for a placement within Canada, so that the university will help you to get a placement in a different, in an organization, or maybe even beat the government. So that is used as an experience for you to working within Canada. That's the only thing I wanted to add. Thank you.
Okay. Good afternoon, my people. My name is Lydia Namgen. I have a question. I think it goes to Dr. Ricardo John. So my question is, how are current mental health trends influencing healthcare and social work? How are current mental health trends influencing healthcare and social work?
Okay, thank you very much. I think he's got it. Can we have another question? We have another one there, and then we shall respond. Thank you.
Yes, thank you so much. My name is Tony Muzira, and I work with the Center for Black Development Options Canada. We also have an upcoming conference next month on the July 4th and 5th, the International Conference on Black Immigration and Refugees. Ours is just to voice policy issues that affect us in this country.
Can you
as we
tell us?
integrate.
Sorry for interruption. Tell us that. Oh, please stand up. I
Yeah,
beg you.
so
Thank you.
mine is not a
Can you
question.
stand up and tell us that organization? There's some information we've missed. Yeah, you know, when you're marketing yourself or when you're marketing something, we really need to get it clearly. Yeah, because we need from here, we are coming there. Yeah, sure.
Thank you, but anyway. Yes, so I work with the Center for Black Development Options Canada, and we're organizing the first international conference on Black immigration and refugees. It's basically policy matters that we are talking about here today. Mine is not a question, but I'm just kind of like providing information. My sister was talking about Canadian experience. Apparently, we are actually working with the Ministry of Labour, Immigration and Skills Development through the Ontario government, the promotion unit, so that they're trying to create information to employers, but also to attract job seekers by providing most of the resources. And one of the things that is being discussed apparently is Canadian experience, which may be scrapped off or create other synergies of how people can integrate. So this is something that is upon discussion, and I would say Dixon Hall may not be in the position to answer that, but it's a policy matter, and these are things that we are going to discuss in the conference to provide policy recommendations, because it has been long overdue. But it's not a matter of just talking about, we have to move from policy to practice. So we create policies and then we practice them to make sure that they benefit everybody. Thank you so much.
Thank you very much. Do we? Okay, I think we are done, just about. Okay, thank you very much. Do you have a question, Mama? Are you sure there was? Oh, yes, yes. Directed to you. Lydia's question.
Okay.
Oh, yes. Sorry about that. Thank
it's
you,
okay.
Ma.
All right. So the question was, if I got it right, concerning how are the trends influencing social work and mental health? The current trends as in the context of Africa or maybe here, both. Okay. Let me start from home, or what is happening in Africa, especially in Uganda. With the new way of how, for example, social work is being taught, or how the course in education has changed, is now bringing the aspect of many clinical social workers, or those ones who are really called social workers. Because previously, as I mentioned earlier, we had a course called SWASA, Social Work and Social Administration. Now those two have been separated. Right now, Makerere University, in the past 2 years, made social work an independent professional course. So the products who have come out of that course, all of them, they are not yet out, but I think the first batch is going to be out this year, is that they are well trained, and as a professional course, many of them are being attached either to mainly hospitals and then even to community. They adopted this from Kyambogo University, because Kyambogo University was the one which first started on professionalizing the course, but at the same time also putting it in context that at least it is beneficial to the community. The other aspect, in looking at it in the context of education, that's how it has been handled, that the new trajectories indicate that it is progressive, and there is all the chance that the products of maybe the trained people from Uganda are fully trained in social work. So that is one something like an advantage. And I have seen some of the social workers even getting their education here, just straight away from their undergraduate and then a master's. There's a MasterCard Foundation and the rest others who have come even not only to McGill University, but I think also at York as well. So there is that opening in terms of that. Now, on the aspect of mental health, for the professionalism, it is okay, but it has not been so much receptive to the patients. I'm talking from the experience I had, that, okay, you may have a conversation with the social worker or the clinical one, ABCD, but again, your doctor may overlook her or his recommendations. So there's a very big, again, that knowledge gap which I mentioned earlier on in the context of mental health, especially how it is being handled in the African context. Now, when it comes to here there's a lot of issues which have arisen out of mental health. For example, the earlier speakers mentioned the aspect of where a man goes to the hospital, but is brought by let me say the husband is brought by the wife in that context. It is also something which is again a challenge, in that the perception of mental health is vis-a-vis the whiteness of someone or the blackness of their color. So that is, and it has brought in very many questions. And then, of course, not forgetting the aspects of the LGBTQ and the other aspects. I had the presentation, especially after the act in Uganda on that, and I interviewed some of the refugees because I'm much more fascinated about understanding the aspects of refugees. So refugees who are in the LGBTQ vis-a-vis the Anti-Homosexuality Act, mental health came out as something which they were challenged with, and it was a very big problem. So to me, that's how I can simply try to tackle that question. But it's an evolving one, and it's big in the context of Canada vis-a-vis the African context. I'm also just trying to learn each and everything. So maybe you can. Okay. Yeah.
Thank you very much. We need to close this session. Are you adding to this, or you're asking another question? I will give you half a second to do that. Thank you.
Yes, and I will wrap the session. So my name is Iclaire Winfred, and I'm a public health specialist, and I also have a social work background. Yes, so I wanted to give an observation in terms of comparison between the linkage and the referral system in Canada and back home. I think it's so strong here. If I went to a doctor and I needed another service, I'm going to be referred to another organization or supporting partner, and I'll actually get the service. But back home, we are really challenged. I'm going to be referred by a social worker, for instance, for legal services. I need to have other social health issues, like a livelihood issue, and the social worker is going to play their job of referring me, counseling me, and then I'm not going to go to where I'm referred to because I don't have transport, for instance, or the other organizations don't have the financing to support my other needs. So I think that's a very big observation. Yes, so that's something we can learn from as social workers who have come from Africa to attend this conference. Yes, so we need to see how we can document best practices from non-profit organizations here, but also it's the government that provides some of the services and resources, which is different from home. Organizations are really struggling. We have good programs in terms of social support, but we cannot provide them. And then we are drained mentally and emotionally as social workers. I cannot see my client suffering, for instance. I'm talking to her about the needs, for instance, to adhere to treatment. And then she doesn't have food. So I'm going to tell you, I'm going to refer to Alex. Alex, you need to take your medication on time so that you suppress your virus. Alex is going to listen to me, and when he goes back home, he's going to throw the tabs because Alex has no food, for instance, to swallow other medication with. So I think that is something that is pertinent for us to learn from. How do we finance the organizations and support social workers? Because we have a session on mental health and wellness. We are drained mentally. Thank you.
Thank you very much. We will not allow to be drained mentally or health-wise. That's the reason why the conference is right here. Come on, give the vision bearers a very big hand clap for this wonderful, very, very creative, extremely patent issues. And then let's clap for our panelists. They've done us so much good. Thank you very much. And let's clap for a lovely audience. You are amazing. You've made all of us very proud. In a special way, we thank the committee members. You're very amazing. Our sponsors, donors, you're amazing. DJ, thank you. Give him a hand clap. Thank you so much. Okay, at this point in time, I think I need to invite Mr. George.
Thank you very much. Sue is a very interesting person. I have been pulled off my seat to officiate the next part of the conference. And my name is George Wilobo, and some questions that were raised here also are, of course, very pertinent to policy development. And I must acknowledge that as organizers of this conference, we extended an invitation to some of the policymakers, including, among others, we invited the Ontario College of Nurses, we invited the Ontario College of Social Workers and Social Service Workers, we invited IRCC, we invited Public Health Ontario, we invited Public Health Canada, and they didn't send their representatives or they didn't honor the invitations. But otherwise, we have a desk that is right from the person that just spoke, Winifred. We have a rapporteuring of the event. We are covering this event, of course, live streaming it as well. And also, we are capturing the communique, which we are going to send to these institutions for informing policy. Thank you very much. Without further ado, we are going to end early. But before we end early, we have a very wonderful last session of this event, which is interactive wellness session. And this is being done by Charlene Gams, a registered therapist as well. And may I know if we have Felicia here? Oh, yes. So, Felicia, I think the registration never captured you. And, this is Charlene. May I know if we have Felicia in the house? All right. If that is not, then may we have Charlene Gams to take us through the next session. Thank you very much.
Hello. So I feel like I've gotten a lot of buy-in already today because it's time to think about yourself and do some self-care. So I'm Charlene Gums. I am a registered social worker and psychotherapy therapist. And today I'm going to take you through some coping strategies, okay? Give me 1 second. So all of the strategies that I'm going to do today are trauma-informed, but I am going to do the typical trigger warning. Do what you need to do to stay safe, which means if I ask you to close your eyes and you want to keep your eyes open, that is fine, okay? So today we're going to work on our emotions. And sometimes our emotion shows up in ways Okay, so just gonna wait for the presentation to get up, but I wanted to remind you that being in touch with your body is very important because sometimes our emotion shows up in ways that we're not aware. How we treat our clients, how we treat our family, how we treat ourselves. Okay? So today, I'm gonna have you really start to think about your emotions. So right now, I'm going to start with a meditation, okay? A guided meditation. So sit comfortably back in your chairs with your back straight and your eyes closed. Begin by focusing on your breath. And feeling the air going into your body and then leaving your body. So I want everybody to get comfortable. Close your eyes. Let's take a pause. Let's take a breath. And place your feet flat on the floor. Often we carry things that we bring home from our clients. So this guided meditation, hopefully, will allow you to notice how your work is affecting you. Now place your hand over your belly or over your heart and take 6 deep breaths. Noticing your stomach rising and falling with each breath. In and out. Take the first client that comes to your mind. Who is that client? What do you sense in your body? Just scan your body and notice what your body is doing. If you'd like, you can write it down. What do you notice? Are you getting bigger or smaller? Colder or warmer? Tense or relaxed? As you bring this person to your mind, now turn your breath inward. Does your breathing change? As you notice this person, how are you feeling in your body? What do you feel as you look at this person? What fantasies or pictures come to your mind as you look at this person? If this person was an animal, what animal would it be? What animal would you be interacting with their animal? What do you like about this person? What don't you like about this person? What do you need this person to do? How is this person like you? And how is this person different than you? What does this person remind you of? Who does this person remind you of? How are they different than you? And how are they like you? Take a few breaths. And then open your eyes. Reflect on the person that you picked. Were you surprised? What personal issues came up for you in that meditation? How can those issues and reflecting on those issues support you as a person, as a social worker, as a student, as a parent? Emotions are powerful. They come out in many different ways. That meditation was meant for you to focus on your emotions and potentially an interpersonal struggle that you're experiencing. And I know there's many social workers in the room, so most of you know what countertransference means. So we don't just bounce all of the things that our clients bring to us. We absorb it. So taking a moment to really connect with your body and figuring out what you're absorbing will lead to better self-care, okay? Whether it's through meditation or prayer. Okay, now we're gonna do therapy exercise, okay? This is an art therapy exercise. It's a technique that feel free to use with your clients if you really connect with it. There is no rules to this. This is your self-portrait. Who are you today? How are you feeling? Okay? On your tables, you should see paper and crayons. Get creative. Okay? We'll give you 10 minutes, okay? So again, there is no rules. This is about you. Yes.